microphone, but I think that you can hear my voice. Thank you for coming to this opening press conference of the FIGO 2012 20th World Congress of International Federation of Gynecology and Obstetrics. Thank you to our distinguished and honorable guests, starting from the ladies, Dr. Flavia Bustreo, who is a member of the WHO, the World Health Organization. She is Assistant Director General, Family, Women's and Children Health. Dr. Babatunde Ozotimehin, who is the Executive Director of United Nations Population Fund, the UNFPA. Dr. Paul DeLay, who is the Deputy Executive Director of UNAIDS, the Joint United Nations Program on HIV and AIDS. And finally, our guest, Professor Gamal Sarur, the President of the Federation, of the International Federation of Gynecology and Obstetrics. We are also waiting, I think she's stuck in a meeting, Dr. Frances Daystierk. She is the President of ICM, which is the International Confederation of Midwives. She should arrive. Thank you for coming to this opening press conference. As I said, the theme of a press conference is the role of professional organizations and in achieving the health-related Millennium Development Goals, that are the goals set by the United Nations in 1990 to be achieved until 2015. Many of them are related to health, women's health. In particular, two are related to women's health and child mortality. But I would like to leave a word to Professor Sarur to introduce the theme and this press conference. Thank you, Professor Sarur.
Thank you very much. It is indeed my great pleasure and honor to have this distinguished panel with us today. It is very rarely that we get top people from different UN organizations sitting together on the same table and have this press congress. So I really, on behalf of FIGO, I thank them very much indeed for being with us here today. They spend long traveling to be with us here, and I'm sure we're going to have a very fruitful and very informative press congress. I believe that the report has been distributed to all of you, and we'll just start by asking Dr. Babatunde Ozotimehin to say a few words. Please.
Thank you very much, Professor Sarur. Good afternoon. Let me welcome you to this press conference and to speak to the role of professional organizations in achieving the health-related Millennium Development Goals. I think at the very beginning, it must be stressed that the achievement of all the 8 goals are important because they're all interrelated. Even though we speak to the MDGs 4, 5A and B, and 6, we also do appreciate that the MDG that relates to gender is important. The MDG that relates to education is also important for us. So in a sense, we're looking at all of the MDGs in order to move the agenda of health forward. And from the perspective of UNFPA, we have been working with professional associations in specific ways to ensure that we achieve the MDGs 4, 5, and 6, particularly 5A and 5B. One of the areas is working with the midwifery program and ensuring that we create and assist governments to train new midwives. And that, I think, is a very important human resource activity in order to be able to provide the skills that look after people. Now, And last year, we produced what we call the world, a global report on midwifery services in the world. And I think that's something which is available for all of you to look at. It actually states quite clearly what is happening with midwifery in every country in the world. And that's a resource that also enables us to identify the gaps that we need to fill. Now, more importantly is the work that we're doing with physicians on the one hand, and midwives and other health workers to facilitate the work they do so that they can relate to communities better. It's important that they work together so that they can move this agenda forward. And in some countries, like Ethiopia, we actually also work with the government to produce health workers that are not midwives, but are appropriate to the needs of that country. So it is about ensuring that human resources for health is produced to ensure that we can meet the needs of countries. And finally, I will just speak to something else that we do with professional associations that is important, and that is the repair of fistulas. We have, in many countries around the world, the issue of fistulas, and we ensure that we work with obstetrician colleagues to train them to be able to repair fistulas of the ground. And there are specific countries that I've seen that have done extremely well. Bangladesh, Nigeria is also another. And Bangladesh actually is training Timor-Leste in order for this to happen. So I'll stop there, and I'm sure there are questions to take.
Thank you very much, Professor Oshitemin. And then, Black, please.
May I ask Dr. Porter to also add some, for Italian colleagues, some data on Italy? Sorry for this nationalization, but it's interesting to them. Sorry for this. Please.
Thank you very much, e che piacere essere a Roma. E se avete delle domande poi in italiano però adesso parlerò in inglese. Every 2 minutes a woman dies from pregnancy and complication of childbirth in the world. She dies, for example, because there is nobody that can provide her blood after she has had hemorrhage from after delivery. Situations like this do not happen in Italy, and the population of Italy is privileged to have access to healthcare and facilities and physicians and healthcare professionals of excellent qualities. And in fact, Italy itself is privileged to have one of the lowest maternal and child mortality rates in the world. What do we do at the World Health Organization with healthcare professionals? And please let me give you also examples in relation with Italy, because this may be more interest to report for the journalists here in the room. What we do with healthcare professional organization, we work very much in the advocacy to promote the importance of these tragedies and of these deaths that I spoke about. For example, we worked with Italian women parliamentarians to discuss the needs for access for women in the world to C-sections, cesarean section, when they have an obstructed labor. And we work with the Italian parliamentarians and the healthcare professionals in Italy to make this contrast, this inequity that exists in the world. We have countries in the world like Mozambique where access to C-section is below what we recommend at the World Health Organization, which is at least 5% of women that in general in the population will need that access. And we contrasted with the experience we have here in Italy, where in some regions of Italy we have more than 30 or 40% of women that actually have C-section. So we are seeing an over-medicalization of the care that is being provided. What we also do with healthcare professionals, we work on the science and the evidence to provide, for example, experimentation or innovation. And we are working very much with several institutions here in Italy to look, for example, at testing one of the new devices that we call Odon device that you will hear about in the conference this week. That is a new tool for facilitating obstructive delivery that does not require a C-section. We also work with the healthcare professional and the academics institution here in Italy on projects that assist quality of care around the world. I spoke about the inequity of that care, and we have, for example, projects that involve the Istituto Burlo Garofalo for improving the quality of care for women and children in Central Asia, in Ethiopia, in Angola. And we have future projects in collaboration, for example, with l'Istituto Nostra Famiglia for a project that screens children with disabilities as soon as before birth and immediately after birth in the region of the Middle East, in countries like Lebanon, Algeria, Libya, and Egypt, that, as you know, are very, very critical countries for Italy. Finally, what we do with healthcare professionals that is of utmost importance, we hold information and share information in public, as we are doing here today with Professor Serur and the Federation of Gynecology of Obstetricians in the world, because they have a tremendous credibility for policy making, for provision and upholding those standards of care I spoke to, and we work with them very, very closely. Thank you.